So that's going to be the first factor. And then second is going to be having these set copays. So if something were to happen up into that high out-of-pocket max number, typically we see that in the range of $8,000 to $10,000. Through a traditional Medicare, you would only be on the hook for $226, which is your Part B deductible, where through an Advantage plan, you may be on the hook for up to that $10,000 if something major were to happen during that time.
Welcome back. Excited to have again Zach Cole, our expert with respect to Medicare and Medicare Advantage plans, which we get to dive into today. So if you're interested about original Medicare, which would be Part A, Part B, a supplement, and Part D typically, we did an episode on that. Today we get to dive into something a little bit different, which is the other side or the other set of options within the Medicare space, the Advantage plans. So Zach, can you unpack just briefly what are Advantage plans and how should clients be thinking about whether they might be a right fit for them?
Yeah, so a Medicare Advantage plan is pretty much going to be all of the parts of traditional Medicare, but bundled into one policy. There's going to be some additional benefits to that policy as well, such as dental, vision, so on and so forth. The biggest thing with the Medicare Advantage plan is we refer to it as more of an a la carte plan, in the sense of you're going to be paying a lower premium for the plan, but you're going to have higher copays on the back end, such as every time you see a primary care, it's going to be a $10 copay. Every time you see a specialist, it's going to be a $50 copay, so on and so forth, up into an out-of-pocket max number. And then you'll also have a deductible there as well in most cases. Within the plan, your prescription coverage would be included within that Medicare Advantage plan. So really is just bundles in every part of Medicare into one package, and then has set copays for all services rendered during that time.
So if we have the gift of prophecy and we know that we're really not going to need any kind of medical element or help from a physician significantly for the next 20 years, and then maybe have some expenses at the very end of life, this might be the path, because it sounds like there are options here that maybe are less expensive on the front end, if I gather correctly.
That is correct. So many times you'll see these Medicare Advantage plans kind of advertise that there is no premium. It's a $0 premium for this plan. You're still paying a premium through Medicare, so you'll still have to pay your Part B premium. But with the actual Medicare Advantage plan itself, you won't have to pay a premium for that. It's just the copays associated to that plan. So that's where you can get a difference in cost between that and the traditional strategy, where you're going to be paying for your supplement and Part D plans as well.
What kind of client or what kind of person would Medicare Advantage be ideal for?
Yeah, so typically with the Medicare Advantage plans, it's going to be for people who don't use their healthcare a whole lot. So someone relatively healthy maybe goes to the doctor once, twice a year for a physical and a checkup. That's going to be the main thing we see with the main client going towards that Medicare Advantage plan, just because they don't see the benefit of paying that higher premium when they're only seeing the doctor once or twice a year. And then also the benefit of having that dental and vision included, just so you don't have to worry about secondary policies, is a major factor for clients.
Let's talk about the other side of things. What should we be a little bit wary about in thinking about going towards Medicare Advantage plans? Are there particular gotchas that we need to be aware of?
So the two major factors with the Medicare Advantage plans is first going to be your network. So with the Medicare Advantage plans, your provider will have to accept Medicare, but they'll also have to accept the network that your Medicare Advantage plan is in. And it does have a hard time traveling. So if you do travel out of state quite often, that can be a factor in finding care outside of your service area. So that's going to be the first factor. And then second is going to be having these set copays. So if something were to happen up into that high out-of-pocket max number, typically we see that in the range of $8,000 to $10,000. Through a traditional Medicare, you would only be on the hook for $226, which is your Part B deductible, where through an Advantage plan, you may be on the hook for up to that $10,000 if something major were to happen during that time.
So this is a little different angle question, but why do we see so many celebrities pitching these plans? I don't see celebrities pitching original Medicare saying, hey, go this route. So what is it with the Advantage plans that we see pushing this? Why is there so much advertising in this space?
The companies want you to enroll into the Medicare Advantage plans. It shifts the liability away from the government onto the individual insurance companies. So that's one of the major factors there. And then secondly, just looking at cost, if you don't use your healthcare, you do save money on the cost of premium. So I'd say that's probably the two major factors there.
As you work with clients, do you find that most of them, they're satisfied with this track, or are there things that they didn't maybe realize and they come back to you and say, hold on, there were some unanticipated things or such?
Yeah, I would say it depends on the client. For someone not using their health insurance a whole lot, it is the perfect fit for them. But someone, let's say, gets a cancer diagnosis halfway through the year and starts accruing these costs, that is something that during open enrollment, we may take a look at that and try to do a switch. You are able to switch back to original Medicare with the supplement plan, but that's where those health questions can become involved. You can get denied based on that. So it is a major factor to consider before making any change.
So if we turn 65 and we sign up for Medicare Advantage, what I'm hearing you say is, let's just say a health event happens 3, 4, 10 years later, whatever it might be, and we'd like to go back to original Medicare, they may deny us, particularly if we're a cancer survivor or something like that, where we have a heightened level of risk, it sounds like.
That is correct.
So something to be aware of. Anything else that you would say that we need to be aware of with the Medicare Advantage plans?
In the same vein as the marketplace, there are constantly new Medicare Advantage plans coming out. You are able to switch between Advantage plans pretty seamlessly. So I would recommend that each year during open enrollment to review that. And then also, depending on the company you work for, there can be offerings from your employer that when you retire, you are eligible for their Medicare Advantage program. And typically, whenever that comes into play, those are going to be very good plans and very comparable to that traditional Medicare strategy and what your copays would be. So some examples we see on that is going to be like the Microsoft, Google's, some major companies. Don't typically see that with any smaller companies, but definitely something to bring up if you're retiring, what offerings you would have through Medicare.
Well, again, we appreciate all of your insight and helping bring confidence and rest to our clients, because we tell this story often, but we had a client who came on board in his late 60s with us and said, gosh, I wish I had been able to work with Zach and his team, because I spent 40 hours trying to figure out which Medicare path I needed to go. And of course, he's one of these that really digs in and reads all the documents, which most of us just at some point after a couple of hours just tap out. But again, it's a delight to be able to work with you and your team. And with that, we'll just, again, thanks for your time. And if you have any questions in watching the video, don't hesitate to reach out to our team. With that, thanks for joining.
Yeah, thanks for having me.
If you like these financial planning videos, please share it with a friend. And if you have questions, go to our website at SiriusRetirement.com. This content was provided by Retirement Planning Services. We are located in Knoxville, Tennessee. You can visit our website at SiriusRetirement.com. The information in this recording is intended for general educational and informational purposes only and should not be construed as investment advisory, financial planning, legal, tax, or other professional advice based on your specific situation. Please consult with your professional advisor before taking any action based on its contents. Advisory services offered through Retirement Planning Services, LLC.